I grew up in a labor camp in Watsonville, California. My parents picked strawberries, raspberries, whatever was in season. And like many immigrant families, we worked hard, we stayed close, and we relied on our community to survive and thrive. In that close-knit farm working community, Planned Parenthood was simply where we went for healthcare. It wasn't political, it wasn't controversial, it wasn't debated. It's where I got my vaccinations when I wanted to play sports. My parents went there for their checkups. It was a trusted healthcare provider, a place that treated working-class immigrant families with dignity and respect. I didn't learn about the controversies about Planned Parenthood until I got to college. It was up until then that I learned about abortion care and how essential it was for the people that needed it. Years later, after spending more than a decade doing community organizing work and fighting to ensure people had access to fair elections, healthcare, and advocacy, I found myself in a conversation with a mentor. At the time, she was the CEO of Planned Parenthood Northern California. She told me she needed me to step into the vice president role. My first reaction? Are you kidding me? Hesitation. I immediately recommended a few brilliant women that I knew, women who I thought would be perfect for the job. Because I reflected and I thought to myself, this is a space that belongs to women. I don't want to take that space up. But she insisted, and she's pretty persistent. I went home and I told my wife. She looked at me and said, "Are you kidding? With your experience and what is happening in this country, we need more male allies in this movement." That paused me. Because the truth, whether we want to admit it or not, men also require and are affected by sexual reproductive health care. This is not an abstract issue. It's a personal issue. And right now, more than ever, men are critical to this movement. We cannot stand on the sidelines. The policies restricting reproductive freedom were largely written in advance and upheld by men. Systems that limit bodily autonomy and access were built in rooms where women were not at the table. So if men help build these systems, then men have a responsibility to help dismantle them. Being an ally doesn't mean taking over. It means standing shoulder to shoulder. It means using our voices and challenging misinformation when we hear it. It means voting, donating, showing up, having hard conversations with other men. It means recognizing that reproductive freedom is not just a women's issue. It's an LGBTQ non-binary issue. It's an economic issue. It's a healthcare issue, it's a racial justice issue, a family issue, but most importantly, it's a human rights issue. When everyone can control their own bodies and their own futures, families are stronger, communities are healthier, economies are more stable. Allyship is not about guilt, it's about responsibility, it's about love, it's about courage. I think back to the labor camp in Watsonville, to my parents waking up early in the morning before sunrise to get ready to pick strawberries, and what our future could have been like if we didn't have access to that reproductive health care and that essential health care that we got at Planned Parenthood. That access shouldn't depend on your zip code, shouldn't depend on your income, and it should not depend on who's in political power. The moment calls for all of us. The time to act is now, not tomorrow, not when it's convenient, not when someone else leads, now. Because the people we love are counting on us, and together, we can build a future where sexual reproductive freedom isn't controversial. It's simply care, dignity, and freedom. Thank you.